More than 100,000 people in Wisconsin are living with epilepsy, a condition with many unknowns and currently no cure. The Epilepsy Foundation works to make life with this neurological condition easier and safer with things like seizure first aid training, support groups and kids camps, and more. These days, more than 100 epilepsy organizations nationwide, though, are worried about potential funding cuts within the U.S. Department of Health and Human Services, the FDA, and the CDC. Our Meryl Hubbard sat down with local and national leaders to see what's at stake.
I asked one day during a support group meeting, I said, somebody tell me something that's good about epilepsy. And some people looked at me saying, what kind of a question is that?
Looking at the glass half full isn't easy when your life flips upside down.
I had a seizure in 1991. I blinked my eyes and all of a sudden I'm in an emergency room.
John Mirasola was about to start grad school at the time. After medication, his seizures disappeared for about 7 years. But when he got his dream job, they came back.
I fulfilled my goal of becoming a high school teacher, but I had to give that up because, 25 teenagers in a room with one adult who doesn't know what's going on is a kind of a recipe for disaster.
Epilepsy cost John more than his career. He stopped driving, swimming, and biking, too.
But what got me through it, I think, was the people.
He found community through the Epilepsy Foundation of Wisconsin, and now has been working for them as a mentor for more than a decade.
I don't have to stop life. I can relate to what you're going through. Please ask me any question you want. My epilepsy, I'm an open book. I didn't used to be.
John is one among millions of Americans living with active epilepsy. But this year, organizations that aim to help people like him are on the chopping block with federal cuts.
After so many years of progress and finally starting to better understand and treat the epilepsies, we're just kind of having the floor fall from beneath us.
Laura Widener with the American Epilepsy Foundation says that federal epilepsy research and programs have seen dramatic cuts in staffing already.
Kind of step one, staff, that's done. And then now funding is on the line for fiscal year 2026.
Looking at the glass half full isn't simple, but John says despite his epilepsy, the foundation gave him a family and a chance to keep teaching, too.
It's another form of teaching, I guess. It's just not to a classroom of 25 teenagers.
Reporting in Madison, Meryl Hubbard, News 3 Now.
Thank you, Meryl. And if you want to support the Wisconsin Epilepsy Foundation, please join John, myself, and others at the Madison Walk to End Epilepsy. It's Saturday, May 10th at McKee Farms Park, and you can register at epilepsywisconsin.org.